Good evening, I'm Brittany Ramsey. Thanks very much for joining us tonight. The regional hospital has now administered about 600 Pfizer vaccines to local healthcare workers, but the supply that arrived just before Christmas will run out in a few days. The next shipment currently isn't scheduled to arrive until at least the middle of the month, meaning local vaccinations will likely have to be paused until those new doses come in. Ryan Benazzo has more on that situation and on the latest COVID numbers.
For the first time in a week, the number of active cases in Thunder Bay has gone up. The district health unit reported 6 new infections on Monday, bringing the total case count to 606, with 63 active. That's up from 57 a day earlier. All of the new cases are in the Thunder Bay area, with 1 at the Roseview Care Home. 4 others were contracted through close contact, with 1 exposure source pending. And 1 additional patient was admitted to hospital. There are now 2 COVID-19 hospitalizations, with 1 of those patients in intensive care. Meanwhile, the Health Sciences Centre continues to vaccinate long-term care workers and high-risk hospital staff.
By end of day, we should have completed approximately 600 vaccine doses.
CEO Rhonda Crocker-Ellicott adds the hospital will run out of its current supply this week. And while there are 2 additional shipments expected later this month, there will likely be a gap between when the current supply runs out and new doses come in.
We will have completed all first doses available by Wednesday, Thursday of this week. We're looking forward to receiving additional shipments through the latter part of January.
Security concerns prevent her from making exact delivery dates public. The hospital is holding back about 100 doses currently on hand in order to ensure those who were vaccinated early on can receive their second shot 21 days later as required, even if the next shipment is delayed.
Our delivery is anticipated close to when the doses are required, within hours, and we just can't put those individual vaccinations at risk. So although the provincial direction is certainly do not hold second doses, in Thunder Bay we're a little bit different in that our vaccines take generally a little bit longer to come from Belgium, and we want to make sure we don't compromise on the vaccine status of any individual.
Hospitals across the province continue to push for faster delivery. The regional is also awaiting word on whether the Pfizer vaccine can be moved off-site and perhaps administered at another larger location. Crocker-Ellicott says with that okay and the needed supply, the hospital could administer about 1,000 vaccinations a day. Ryan Benazzo, TBT News.
Meanwhile, the province of Ontario began administering a second dose of the vaccine today to some healthcare workers, but it comes amid growing concern over the low number of doses that have been delivered province-wide. Colin DeMello reports.
For the second time in 21 days, Anita Quindanjan, a personal support worker at a downtown long-term care home, got her shot in the arm on her way to being fully inoculated against COVID-19.
Now that I'm done, I'm more happy.
Outside that very facility, dozens of healthcare workers were lined up for their vaccine, many of whom received their email this morning and rushed to receive it.
It was exciting. I'm glad that we're getting the opportunity to do it.
But even here, there are concerns about the general state of the province's vaccination program.
Part of the efficacy of the vaccine program will be its rapid deployment. So the sooner that can happen and the sooner we can reach that threshold, the better.
That sentiment is being shared today by frontline physicians who say the province needs to speed up its rate of vaccinations. Ontario currently has 150,000 doses of the COVID-19 vaccine, out of which a little over 42,000 have been administered so far.
Vaccinating people in long-term care homes should be the easiest thing. We know where they all live. We have the addresses of the home. We know how many people there are. There's no reason why these vaccines should be sitting in freezers and fridges.
Today, Premier Ford acknowledged the issue and promised to do better.
With any rollout that we've had throughout this pandemic, there's a few bumps in the road. We're ramping it up, and you're going to see a significant difference over the next few weeks there.
But the government hasn't provided any details about that ramp-up, which is why critics of the Premier are calling for the return of the Ontario legislature to get some of those answers.
There's something wrong with the distribution process. And part of the solution is to force that transparency and to get at what it is that's going wrong.
The government has not committed to an early return of the legislature.
And we'll have more on the vaccine rollout a little later on in the news hour. Meanwhile, the nightmare continues for residents and their families at the Southbridge Roseview long-term care home. The facility has been dealing with an outbreak for nearly 7 weeks, and now an infected staff member was improperly allowed to report to work. Company officials are blaming it on human error and insist the staffer did not provide personal care to residents on the 2 nights in question. Troy Charles has details.
I really don't have absolutely zero faith that they have this outbreak under control. And I don't know if they are capable of getting it under control at this point.
Maureen Halushak's mother is a resident at Roseview who has managed to avoid COVID during the outbreak. But that was put in jeopardy after Halushak was informed by Roseview that a COVID-positive worker had been working at the facility in late December and had been in her mother's room. Roseview officials did apologize to Halushak, saying the breach was a result of human error, but that was not enough to quell the frustration.
So as a family member who is grateful every single day that my mom has not tested positive during this outbreak, to hear 45 days into the outbreak that a worker who had tested positive was working in the home is absolutely infuriating.
In a statement, Southbridge says they, along with the health unit, called the employee's cell phone numerous times on December 28th and 29th to inform her of the positive test, but were unsuccessful. She was eventually informed at her home on the 30th, but because she didn't receive the earlier messages, she showed up for work on the 28th and 29th and was adamant about working her shifts, so the security guard mistakenly allowed entry. The home is now creating a more detailed process to ensure only staff with a verified negative test and on a scheduled shift may enter the home. Unifor Healthcare Director Andy Savella believes homes like Roseview just don't have the staffing capacity to stop the spread of the virus. Halushak has her own suggestion on what should happen at Roseview.
I would love to see the hospital or the health unit take over management of this home until the outbreak is over and every resident and staff member has been vaccinated, because it's really obvious that Southbridge does not have this under control.
Halushak's mother had her most recent COVID test on December 31st, and it has come back negative, which Halushak is very grateful for, but says her mom is not in the clear just yet. Troy Charles, TBT News.
Northern Ontario's 2-week lockdown imposed by the Ford government is set to be lifted this Saturday, but whether that actually happens or not remains to be seen. The lockdown began on Boxing Day, forcing the closure of many public buildings, gyms, and restaurants in the Thunder Bay area. It was scheduled to come to an end after 14 days, depending on the COVID situation at the time. Mayor Bill Morrow points out that the number of active cases here has decreased significantly in the past week, and so far he hasn't heard any rumblings about that lockdown being extended even further.
Yeah, to my knowledge, so far, no. I haven't heard one way or the other any plans that the province may have, but I would expect, towards the end of the week, we'll probably begin to get some sense. When they brought the lockdown in for the entire province for 28 days, for the north for 14 days, they were concerned about what might happen through the Christmas season and with Christmas holiday gatherings and Boxing Day shopping and that sort of thing. So they've made that decision. We're beyond that time now, so I would expect that they'll factor that into whether or not they choose to extend or end for Northern Ontario.
Now, Medical Officer of Health Dr. Janet DeMille has scheduled an interview with us on Thursday, which could include more information on the status of the lockdown. And there are some new cases of COVID-19 to report around the region today. Last night, the North of Superior Healthcare Group confirmed Terrace Bay's first official case. The individual is said to be experiencing mild symptoms and is self-isolating at home. Meanwhile, an outbreak has been declared in the long-term care wing of the Atikokan General Hospital following the confirmation of one staff member testing positive. The hospital issued a statement Sunday stating its occupational health nurse and public health staff are monitoring and coordinating with the affected staff member. The release says residents in the LTC area have already been isolated, PPE supplies are well stocked, and regular meetings with the hospital's incident management team and the Northwestern Health Unit have begun. In an effort to treat more patients without increasing the COVID-19 exposure risk, the Thunder Bay Regional Hospital has unveiled a new virtual emergency department. The program is being offered in partnership with Ontario Health. Patients 17 and older in the Thunder Bay area can now be assessed online by an ER doctor through a secure video chat without making the trip to the hospital's emergency room. Same-day appointments can be booked through the hospital website on a first-come, first-served basis. Hospital Trauma and Emergency Care Director Lisa Beck says the program is geared toward those in need of urgent but non-life-threatening care.
Are having medical crisis or urgent conditions such as a heart attack, signs of stroke, mental health crisis, we really want them to continue to come to the emergency department. So this would be patients that might want to have an appointment for things such as a sore throat or a shoulder injury or things that are less acute but still need to be addressed within the next 24 hours.
This idea itself was brought up locally prior to the pandemic, and trying to model it after some hospitals in Southern Ontario that had done this again pre-pandemic. And then as the pandemic sort of encroached upon healthcare and people's ability to access care, it became a priority for Ontario Health to provide this pilot project.
Emergency room visits have decreased during the pandemic, and there's worry that some health problems are going untreated. Virtual appointments are now available from noon to 6 p.m. daily. Those who book will be emailed an invite to the virtual session. The service is currently only available to those in the Thunder Bay and surrounding areas due to internet connection requirements. Just 2.5 years after they ended a bitter, protracted strike against the doctors who employ them, staff at the Port Arthur Health Centre will vote this week on whether to stick with their union. Under provincial legislation, a vote must be ordered if an application is filed with the Ontario Labour Relations Board when at least 40% of a bargaining unit's members appear to have expressed a wish not to be represented by a trade union. That is the case for health center staff, so the vote is scheduled to be conducted online over a 24-hour period starting at noon on Wednesday. If more than 50% of the ballots are cast in opposition to the union, Unifor will no longer represent the employees in the bargaining unit. Andy Savella, the healthcare director for Unifor, said he's confident a majority of the current staff will vote to stay with the union. A by-election on Fort William First Nation, originally supposed to take place today, has been delayed by a week because of provincial lockdown measures. The by-election is being held to fill the role left after the passing of longtime councillor Leo Bannon in 2019. 8 candidates have confirmed their nomination. The list includes Edmund Collins Jr., Sarah Levesque-Morisseau, Bailey Miyawasagi, Paul Morisseau, former band CAO Ken Ajima, recent candidate for Chief Bonnie Pelche, as well as Murray Pelche and Todd Pelche. Campaign signs have been posted around the community for over a month now. The vote will take place Monday, January 11th. Ballots will be counted at the Fort William Community Center when polls close at 8 o'clock. A flag-raising ceremony was held today to bring awareness to the Thunder Bay District Crime Stoppers organization. The ceremony proclaimed the month of January as Crime Stoppers Month. This is the first time a flag has been raised at City Hall to recognize the Crime Stoppers initiative in Thunder Bay. Mayor Bill Morrow, City Police, and board members from Crime Stoppers were in attendance to commemorate the event. District Chair Sean Peremisco has been a part of the organization for 8 years, says crime tips have increased over the years, and he hopes the official proclamation will bring awareness to the cause.
I would like to hope so. Due to COVID restrictions, last year was very difficult for us to get out like we usually do. So I'm hoping that proclaiming January as Crime Stoppers Month will just keep the public aware that we are still operating even though during COVID times, and that we're still around, and hopefully better things to come this year for us.
The event also marks the start of a year-long campaign to highlight various issues that occur in the city and to help all communities stay safe. Meanwhile, another cougar has been caught on video in the Thunder Bay area, and this time it was just outside city limits. This video was taken from a trail camera set up near the corner of Highway 61 and Highway 130, shows an adult cougar checking out its surroundings before heading off into the night. The sighting took place on New Year's Eve, less than 200 meters from Chris Maley's back door. Maley provided a tour of the location where his trail cam is set up and showed off the paw prints left behind. He says before capturing the cougar on camera, he was always a bit skeptical about previous reports of this species being seen around the area.
Very surprised when I seen it. Never seen a cougar before. You know, generally coyotes, rabbits, and whatnot, the odd lynx, but you know, you hear stories of cougars, but I've never seen one personally myself, and to catch one on a video was extremely lucky for me.
Maley says he'd like someone from a provincial ministry to come visit the site to have it officially confirmed before snow erases the visible tracks.
Well, Fiona,